Welcome to today's video about silent symptoms of ulcers. What if a serious medical condition was silently developing inside your body right now without any pain to warn you? According to medical research, approximately 43% of patients with bleeding peptic ulcers experience no abdominal pain whatsoever. Today we're unveiling 12 silent symptoms that could indicate an ulcer is forming in your digestive tract, even though you feel no classic burning sensation. Research from major medical institutions has confirmed that truly silent ulcers exist, particularly in elderly patients and those taking certain medications. Understanding these subtle warning signs could be life-saving. The symptoms we'll discuss are well documented in medical literature. Let's explore these hidden danger signals together. All right, let's dive into the list of silent ulcer symptoms, starting with number 1, iron-deficiency anemia and chronic blood loss. The first silent symptom develops so gradually that most people attribute it to simply being busy or stressed. When an ulcer forms in your stomach or small intestine, it can bleed at such a slow rate that you never notice blood loss directly. Over weeks or months, this microscopic bleeding steadily depletes your body's iron stores, leading to iron-deficiency anemia. A study published in the New England Journal of Medicine examined 100 patients with iron-deficiency anemia and found that peptic ulceration was the most common abnormality in the upper gastrointestinal tract. What does this look like in your daily life? You might experience persistent fatigue that doesn't improve despite adequate sleep, unexplained weakness making routine activities feel exhausting, noticeably pale skin that friends comment on, or shortness of breath when climbing stairs. Research published in BMC Gastroenterology studied patients with iron-deficiency anemia who had no gastrointestinal symptoms and discovered that bleeding-related endoscopic lesions were common findings. The insidious nature of this symptom means your brain gradually adjusts to feeling progressively worse, making it difficult to recognize something is seriously wrong. If you've been experiencing increasing fatigue despite rest and proper nutrition, investigating whether silent bleeding could be responsible is crucial. Next, symptom 2, Melena, black, tarry stools. This symptom is visually dramatic, yet surprisingly, many people delay seeking medical attention when they notice it. Melena refers to stools that are jet black, tarry in consistency, sticky, and have a distinctively foul odor. Medical literature explains that melena occurs when blood from a bleeding ulcer travels through your digestive tract and gets digested by stomach acids and intestinal bacteria. This process transforms bright red blood into a dark substance. Research indicates it takes approximately 50 milliliters of blood in the stomach to turn stools black. Medical authorities, including the Mayo Clinic and Cleveland Clinic, have established melena as a critical warning sign of upper gastrointestinal bleeding, including from peptic ulcers. What makes this particularly relevant to silent ulcers is that melena can appear even in the complete absence of abdominal pain. According to medical literature, the most common cause of melena is peptic ulcer disease. Some individuals notice this alarming change but delay seeking care, either from embarrassment or because they feel otherwise fine. This delay can be dangerous, as melena indicates significant bleeding requiring prompt medical evaluation. True melena has a sticky, tar-like consistency and unmistakable odor that distinguishes it from stools darkened by iron supplements or certain foods. Next, symptom 3, occult blood in stool. This symptom is particularly sneaky because you cannot detect it with your eyes alone. It requires specialized laboratory testing to reveal its presence. Occult blood refers to blood in the stool that's invisible to the naked eye, present in such microscopic quantities that it doesn't change the stool's appearance but can be detected through fecal occult blood tests. These tests use chemical reactions to identify even trace amounts of blood that might indicate bleeding anywhere along your digestive tract. While this is more of a diagnostic finding than a symptom you'd notice yourself, understanding its significance is crucial for early ulcer detection. Many people undergo routine screening tests, particularly those over 50, and are surprised when results come back positive for occult blood. This discovery often triggers further investigation through colonoscopy or upper endoscopy, which may reveal a previously unknown ulcer. Medical research has documented that occult blood in stool can be the earliest detectable sign of a silent ulcer, appearing long before any other symptoms develop. Studies on iron-deficiency anemia and gastrointestinal bleeding show that occult blood testing frequently leads to the discovery of peptic ulcers in patients who had no symptoms. Some ulcers bleed intermittently at such low levels that patients remain completely asymptomatic except for this laboratory finding. Next, symptom 4, vomiting blood or coffee grounds material. Imagine experiencing some nausea, then suddenly vomiting what looks like coffee grounds or bright red blood. For some individuals with silent ulcers, this dramatic event is the first indication that anything is wrong. The absence of preceding stomach pain makes this symptom particularly shocking. There was no warning to signal that a serious problem was developing. Medical literature extensively documents hematemesis, the medical term for vomiting blood, as a potential presenting symptom of peptic ulcers. According to research published in Stat Pearls and clinical reviews, when blood remains in the stomach before being vomited, it undergoes partial digestion by stomach acid, giving it a dark, granular appearance, remarkably similar to coffee grounds. Fresh, bright red blood in vomit indicates more active bleeding. Research from NCBI Bookshelf explains that coffee ground emesis describes gastric vomitus containing dark specks of old blood. Studies show some patients experience this bleeding episode without ever having felt typical ulcer pain. The ulcer may have been developing silently due to its location or individual variations in pain perception. A study analyzing over 6,000 patients found that coffee ground vomiting was associated with upper gastrointestinal pathology requiring immediate medical evaluation. Vomiting blood is a medical emergency requiring immediate attention, even if you feel otherwise well. Next, symptom 5, dizziness, lightheadedness, or syncope. You stand up from your chair and suddenly the room starts spinning, or you feel like you might faint. You might attribute this to standing too quickly, dehydration, or skipping breakfast. But what if it's your body's response to slow, steady blood loss from a silent ulcer? Dizziness, lightheadedness, and even syncope, the medical term for fainting, can result from blood loss associated with bleeding ulcers, even when no abdominal pain is present. Medical research has documented that these cardiovascular symptoms occur because blood loss reduces your overall blood volume and decreases the oxygen carrying capacity of your blood through anemia. Your brain is particularly sensitive to reduced oxygen supply, which manifests as dizziness or lightheadedness, especially with position changes or physical exertion. In more severe cases, blood loss can be sufficient to cause syncope, where blood pressure drops so low that you temporarily lose consciousness. The insidious nature of these symptoms, when related to silent ulcers, is that they often develop gradually as chronic slow bleeding progressively depletes blood volume. You might notice increasing episodes of feeling lightheaded over weeks or months without connecting these symptoms to a gastrointestinal problem. If you're experiencing unexplained dizziness or have fainted without an obvious cause, investigating whether occult bleeding could be responsible is essential.
Next, symptom 6, fatigue, weakness, or lethargy. Fatigue is one of those vague symptoms that can be attributed to countless causes: insufficient sleep, stress, poor diet, lack of exercise, or simply the demands of modern life. This non-specific nature makes it particularly dangerous when the underlying cause is something serious, like a bleeding ulcer. The fatigue associated with silent ulcers develops because chronic, gradual blood loss leads to iron-deficiency anemia, which means your red blood cells cannot carry adequate oxygen to your tissues. Unlike the acute exhaustion you feel after a sleepless night, the fatigue from chronic blood loss develops insidiously. You might notice that activities requiring minimal effort, like walking to your car or climbing stairs, leave you feeling disproportionately tired. You wake up feeling unrefreshed despite sleeping 8 hours, and by midday, overwhelming lethargy makes concentration difficult. Your muscles feel weak, and even mental tasks seem to require more effort than usual. Research shows that patients with bleeding ulcers often report having felt increasingly tired for months before diagnosis, but they attributed their fatigue to external factors rather than an internal medical problem. The gradual nature of the symptom means your baseline shifts slowly, making it difficult to recognize how much your energy has declined. If you've been experiencing persistent fatigue that doesn't improve with rest, medical evaluation is warranted. Next, symptom 7, palpitations or tachycardia. Have you ever noticed your heart racing when you're simply sitting still, or felt an uncomfortable awareness of your heartbeat during routine activities? While palpitations and rapid heartbeat can result from anxiety or caffeine, they can also be your cardiovascular system's response to blood loss from a silent ulcer. This connection often surprises people because we don't typically associate heart symptoms with digestive problems. Here's the physiological explanation. When chronic bleeding depletes your blood volume or causes anemia, your heart compensates by beating faster to maintain adequate blood flow and oxygen delivery to vital organs. Your cardiovascular system is essentially working overtime to make up for the reduced oxygen-carrying capacity of your blood. You might notice your heart pounding after climbing stairs, feel like your heart is racing while lying in bed at night, or experience uncomfortable awareness of your heartbeat during activities that previously caused no such sensation. Medical research indicates that tachycardia can develop in response to anemia and reduced blood volume, even when patients have no abdominal symptoms to suggest an ulcer. Your body prioritizes maintaining blood flow to critical organs, so the cardiovascular system adapts by increasing heart rate. If you're experiencing unexplained palpitations, especially in combination with fatigue or dizziness, complete medical evaluation is important.
Next, symptom 8, pallor, pale skin and mucous membranes. Sometimes the people around us notice changes that we ourselves miss because we see our reflection daily and don't perceive gradual shifts in appearance. Pallor, unusually pale skin and mucous membranes, is one such change that friends or family might comment on before you notice it yourself. When someone says you look pale or washed out, especially if you've heard similar comments repeatedly, it's worth taking seriously. Pallor develops as anemia from chronic blood loss progresses. Hemoglobin, the protein in red blood cells that carries oxygen, is also what gives blood its red color and contributes to the healthy pink tone of skin and mucous membranes. As hemoglobin levels drop due to ongoing blood loss from a silent ulcer, your skin loses its normal coloration. Medical professionals often check for pallor by examining the conjunctiva, the inner lining of the lower eyelids, as well as the nail beds and palms. What makes pallor especially significant as a silent symptom is that it reflects a physiological change caused by prolonged bleeding, yet many people with this sign feel relatively well otherwise. They might attribute their pale appearance to being tired or simply their natural complexion. However, noticeable pallor that develops over time warrants medical investigation. Simple blood tests can reveal whether anemia is present. Symptom 9, unexplained weight loss or reduced appetite. Weight loss is often celebrated in our culture, so when the number on the scale drops without deliberate effort, many people feel pleased rather than concerned. However, unintentional weight loss, particularly when accompanied by reduced appetite, can be a significant warning sign of underlying medical conditions, including silent ulcers. Medical literature documents that some individuals with gastric ulcers experience weight loss and appetite changes even without experiencing pain. The mechanisms behind this symptom are complex. Some patients subconsciously begin avoiding food because eating triggers subtle discomfort they don't recognize as pain, perhaps a vague sense of fullness, mild nausea, or indefinable unease. Others experience genuine loss of appetite, where food simply doesn't appeal anymore. Gastric ulcers in particular may affect appetite regulation more than duodenal ulcers, and the associated inflammation or delayed gastric emptying can contribute to feeling less hungry. What distinguishes this weight loss from intentional dieting is its unplanned nature. You're not trying to lose weight, yet your clothes fit more loosely, you skip meals without really noticing, and food just doesn't seem appealing. If you've lost more than 5% of your body weight over 6 months without trying, or if appetite has significantly diminished without explanation, medical evaluation is warranted.
Next, symptom 10, early satiety and postprandial fullness. Imagine sitting down to a meal you've been looking forward to, taking just a few bites, and suddenly feeling uncomfortably full, as if you'd eaten an entire feast rather than a small portion. This phenomenon, called early satiety, involves feeling full after eating much less food than normal. It's closely related to postprandial fullness, that bloated, overstuffed sensation that persists long after a meal should have been digested. Medical resources document that these symptoms can occur with ulcer disease even in the absence of pain. The physiological explanation involves several mechanisms. Ulcers and the inflammation surrounding them can affect normal stomach motility and the coordinated muscle contractions that move food through your digestive system. When gastric emptying slows, food remains in your stomach longer, creating persistent fullness. Additionally, the stomach's ability to relax and accommodate a meal may be impaired when ulcers are present. What makes these symptoms particularly relevant to silent ulcers is that many people experience early satiety and fullness without any accompanying pain. They might mention casually that they can't eat as much as they used to, but they don't recognize these as potential signs of an ulcer. Over time, these symptoms can contribute to unintentional weight loss and nutritional deficiencies. Next, symptom 11, belching, burping, and dyspeptic symptoms. We've all experienced occasional indigestion, that general sense of digestive discomfort accompanied by belching, gas, or bloating. These symptoms are so common that many people dismiss them as normal consequences of eating certain foods or eating too quickly. However, when these dyspeptic symptoms become persistent or more frequent, they may signal an underlying problem like an ulcer, even when pain is absent. Medical literature documents that mild upper gastrointestinal upset can be present in ulcer disease without obviously painful sensations. Belching and burping occur when excess gas accumulates in the stomach or esophagus and needs to be expelled. While everyone experiences this occasionally, frequent belching may indicate altered stomach function related to an ulcer or associated gastritis. Similarly, bloating, that uncomfortable sense of abdominal distension and gassiness, can result from disrupted digestive processes caused by ulcers. The inflammation and altered motility associated with ulcer disease can affect how efficiently your stomach and intestines handle gas and move food through the digestive tract. The challenge with these symptoms is their non-specific nature. Countless conditions and dietary factors can cause similar complaints. However, when dyspeptic symptoms persist for weeks despite dietary modifications, they deserve medical attention. Some individuals with silent ulcers experience these mild complaints as their only symptoms.
Next, symptom 12, occult signs found during screening. The final silent symptom isn't really a symptom at all. It's the discovery of ulcers during routine endoscopic examination in people who have no complaints whatsoever. This finding has important implications for understanding just how silent ulcers can be.
Research from large screening studies has demonstrated that when asymptomatic individuals undergo upper endoscopy as part of routine screening programs, a surprising number are found to have ulcers they never knew existed. A landmark prospective study published in Gastrointestinal Endoscopy examined over 6,000 Chinese subjects undergoing routine screening endoscopy and found that 704 patients had peptic ulcer disease, of which 2/3, 496 patients, were completely asymptomatic. This represents approximately 11% of the screened population having ulcers with no symptoms. These discoveries challenge our assumptions about ulcer disease. We typically think of ulcers as causing pain, prompting symptoms that drive people to seek medical care. However, screening studies reveal that some ulcers develop and persist without ever causing symptoms the patient recognizes. Factors influencing whether an ulcer causes pain include its location, depth, individual pain perception, and inflammation. Understanding that silent ulcers exist should lower your threshold for seeking medical evaluation if you have risk factors like long-term NSAID use or Helicobacter pylori infection. As we've explored today, ulcers don't always announce themselves with the burning pain we expect. These 12 silent symptoms, from iron-deficiency anemia and Melena to subtle digestive changes and incidental findings during screening, demonstrate that your body may be sending quieter distress signals. Research has documented that approximately 43% of patients with bleeding peptic ulcers have no abdominal pain, and screening studies have found that 2/3 of detected ulcers can be completely asymptomatic. The key takeaway? You know your body better than anyone else. If something feels off, even if it doesn't match classic symptoms, trust your instincts and seek medical evaluation. If this video provided valuable information, kindly type "helpful" in the comments below. Your feedback motivates us to create more evidence-based health content. Please give this video a thumbs up, share it with friends or family who might benefit, and subscribe to our channel for more health insights. Thank you for watching, and remember, take those subtle symptoms seriously.